Pots. Orthopaedics. I hope you enjoy this series of conditions on orthopedics. Osteoarthritis can be primary or secondary. Abnormal cartilage, bone, deformed head. As in hip joint, ochronosis, deposition of black discoloration. See that? From homogentic acid deposited in the cartilage, softens up and wears out. Segment away. Radionecrosis here from radiation for testicular CA, deformed head. Here's one case from dermatomyositis. AVN, another case, abnormal bone, steroids, pemphigus conditions, big flat, need hip replacement. Other causes are, slipped upper femoral epiphysis, pistol grip deformed, abnormal loads, secondary OA. Same with Perthes, enlarged deformed hip, secondary OA. Other causes, secondary OA as an adult, pistol grip again, slipped upper femoral epiphysis, the leg shortened, or externally rotated flexors. Externally rotates in your flexors. You have to pin it in situ, hope it heals, later develops secondary OA. Meniscus. How do you size the knee? How can you tell which side of the knee it is? Which is medial, which is lateral? Well, actually the medial one is bigger, isn't it? So you know that's the medial side. Okay, now talking about tumours. Tumours can be primary or secondary. Secondary is a met. Malignant or benign, can arise from any tissue of the bone. From the bone, osteosarcoma, from a cartilage, chondrosarcoma, unknown, GCT, Ewing's. And from fat staging is important to distinguish from infection, especially in children. X-ray, CT, MRI, dump biopsy is important. High-grade osteosarcoma, the upper tibia, 13-year-old male. Here's a tumour, high-grade upper tibia, showing necrosis, destruction of the bone. Typical change to X-ray and MRI, unfortunate, and histology, unfortunate, required amputation. Chondrosarcoma, proximal humerus, 47-year-old female. Typical appearance, mottled appearance, cortex largely intact, hot bone scan, resected, limb salvage procedure. Chondrosarcoma of the upper femur, 72-year-old female with a fracture and required amputation. GCT, lower femur, 31-year-old female, vast destruction, fracture, lower femur, resected, and fusion of the knee. Ewing sarcoma, children, 16-year-old male, pain out, football destruction, possible humerus, typical round cells, typical appearance, MRI, and resected, limb salvage procedure. Benign, a 41-year-old fibroma, finger resected, and here it is, pigmented, blue, and pot. Another benign lipoma, found around the shoulder. Rare fibrocondromatous hematoma, upper fibula, child, very rare. Paget's disease, common UK, Australia, New Zealand, disorganised bone, abnormal proliferation, probably a viral infection. 51-year-old, large deformed head, disorganised bone, secondary OA, requiring a hip replacement. Infection in orthopaedics can be devastating, can be in the bone or in the joints, can be primary or secondary, can come from the blood. Treatments, rest, hydration, antibiotics. Here, trauma, tibia, debrided, fixed, went on to infection, swelling, dead bone, had to be removed. Gout, it's an abnormality metabolism involving uric acid, high levels deposited in and around the soft tissues. Here it is, deposited around the elbow. Size, loose bodies and joints, locking and pain. Here it is, and the knee joint. Morton's little tumour on digital nerves of the foot. May need to excise it. Pain between the toes. Here's a little neuroma being excised. And here it is in the pathology pot. Freiberg's disease, AVN, second metatarsal head, very painful. Here is the head resected. Here's the X-ray appearance. Dupuytren's quite common. Viking origin, abnormal contracture of the tissues under the skin, usually the hand, sometimes the foot. Severe deformity here, it's not enough to take out the contracted tissue, actually exercise the little finger. Disc rupture, spine, lower part, may cause pressure on the nerve, back and leg pain. And here's a large sequestered disc removed from the spine. Yeah, here's my finger, see how big it is? And a lot of pressure on the nerve, very severe pain. A rattler is a slip of one vertebral body on the other, and usually L5S1. Old operation, take out the posterior arch of the vertebral body. That's an old operation, we tend to fuse it now. Clubfoot, abnormal position of the foot, serial casting, but where it's rigid, an old operation is remove the tail as a rigid clubfoot. I hope you enjoyed the series.